Hey doc, it's Nick. This is the case I'm referring to you from Rumford. Patient is Maury. This CAT scan was taken up at KRD, so it's a little bit difficult for me to just send it to you. It'd just be easier if I did a video like this here. So patient doesn't like the palate of her denture. She had her teeth removed a year or two ago, and then denture's been in, and she's been miserable since. So she's ready to take the jump. So we had planned. We did a full review of Form 17, and then we came up with conventional overdenture. Would love to do a bar here, but patient has limited finances. So we're going to do 6 implants for the cost of 4. Something around $9,500, which would be good production for what we're going to be doing. Let me start by saying there's some root tips left over. So each of the sites, you're going to have to be cognizant of that. I would probably lay a flap and just make sure that any of these potential infected root tips are removed and then mildly grafted before or after closing up the case, before the implants get placed, and after you close up the case, just ensure that it's all gone. Let's start with the implant sizes. So I placed them pretty much where I thought they should go. The anterior bone is rather protruded, which is not great for overdenture. So we're going to try to put these implants where we can have them most axially aligned. The number 3, we'll call this 3, 4, and 5. Number 3 implant, I have at a 5x7, something in that ballpark will get you this. Because it's not grafted, you could do densa here, so you could probably bump this up even more to a 5x8 or 5x9 without much of an issue. Implant number 4, plenty of bone, you're looking at a 5x9. You could do a 5x10, 4.6 by 10.5 would probably be a good one. Plenty of width there. And then we'll call that tooth number 6. You're looking at a 4.5 by 12. You could go even longer if you wanted. I think 12 is plenty long enough. Coming over to the other side, number 11, or sorry, number 12, we'll call that a 4 by 10. This is the one that's most axially inclined. So I might just be aware of this possible perforation, but try to split the difference so that you're grabbing this cortical plate, but you're not going to poke through, but you're not axially tilted too much. Number 13, 4 by 10, another potential root tip there. And then number 14, 4.5 by 7. Again, you can use the densa to give yourself some more vertical height. Just to show you what's in the anterior so that you don't think we're missing an opportunity to place some anterior implants. You can take a look right here. Just not good bone in the anterior. And as we go more posterior, it gets better as far as its thickness, but the axial inclination is rather severe. She looks like she might have been class 3, which gives us the inability to place the implants anteriorly. So 3 implants, measuring from the midline to that first implant. Let's take a look. Somewhere around 20 millimeters. To make it easy, I would just do 19 and 19 from the midline. And then from center to center, you're looking at 8 millimeters. And 8 millimeters. So 19, 8, and 8. My guess is this side's probably the same. 19, 8, and 8. Those will be your center points, and then you create the osteotomies from there. As far as the potential bone spicules that are left over, let me just pan up and down. So on that left side, you can see here and here. So they're really, fortunately, right in the zone of where we want to place the implants, but they'll be easy enough to pop out. Just lay the flap and get them out pretty straightforwardly. Right side looks pretty good. Take that back right around number 6. Looks like there's something going on there. So as with all locators, we want to get these as parallel as possible. So what I would do is, do your blocks. I'd probably do 2 V2 blocks with the external approach. And then lay your flap, get your osteotomies in, and then put all your guide pins in at the same time. And then continue keeping those in there as you widen the osteotomy so that you're maintaining parallelism throughout the procedure. The more parallel these are, the better the locators will function long term, especially when you have 6. All right, I hope that's a good case for you. Keep me posted and take good care of her. All right, man.